Okay. Well, welcome. First of all, let me thank my dear friend Eileen Gavin for being my very first guest on the Relentless School Nurse in Conversation. So the reason I decided to do this, I've been thinking a long time about doing a podcast, but I feel like given COVID-19, we need to see each other. We need to see faces. We need to connect, even if it's this virtual connection. So I asked my dear friend Eileen Gavin to be my inaugural guest because of all the things that Eileen's doing. First of all, because of who she is as a human being, as a nurse leader, and all the things she's doing around COVID-19. So just a little bit of background about Eileen. Eileen is a nurse practitioner. She has incredible experience in emergency. She was an ER nurse. She is the co-lead nurse of her school district, Middletown Township. She is a Johnson & Johnson fellow, mentor, community coach. She's a published author. I can't say enough about who Eileen is, but she's also a trailblazer, and I like to call Eileen a school nurse coach. So I invited Eileen to join us today in conversation about what is happening in her district for COVID-19 and nationally. So welcome, Eileen. I want to thank you from the bottom of my heart for being my very first guest. And let's get started. I want to hear a little bit about your nursing journey and what's happened now for you and your school district.
Okay. So thanks. First of all, I'm so honored, Robin. I'm been following you since we met 6 years ago, and really proud to be your friend and all that you've accomplished. So I'm thrilled that I'm one of your first guests. I know you could have chosen anybody out there that, all the connections and networking that you've done through your social media. I know you could have chosen anyone as their first guest. So I am truly honored. So I am a nurse for 37 years. I did the math before we got on. So 37 years. I am a product of an associate degree program and I was 20 years old when I worked in an emergency room in um, New York, Staten Island, New York. I was very fortunate to work with a wonderful head nurse who, back then, there was a culture of nurses eat their own, and I had a nurturing head nurse. She demanded respect. She wore her nursing cap every day. She would send you home if you weren't dressed appropriately. She had a lot of pride in nursing, and she really was the first one to kind of mentor me into my nursing career. Believed in me and kind of guided me and saw that I could. Eventually, she had me taking supervisory roles in the emergency room, and I was 22 years old. So I was a very young nurse, and she really did believe in me and believed in everyone that worked for her. She was really a wonderful role model. And to have her in when I was a novice nurse, it goes without saying, I think she really did launch my career.
What was her name, Eileen?
Her name was Barbara Unright. She just passed a couple of years ago, and I wrote a blog about
I
her because,
remember.
yeah, she really, and she is from the greatest generation. And we have a common friend, Jeannie, who is similar nature. No, not with Barbara, but she
Oh, I
reminds
see.
me so much of Jeannie.
Wow.
And Jeannie Keepner, just to have a name with it, kind of really holds nursing in a high regard and a specialty practice, and that um, you could really be a leader in whatever you do, grabbing onto opportunities and being a leader, in anything that you do. But I did start as an emergency room nurse. I continued on to get my degree. I worked in NYU for a while, and I continued to get my degree. I got married, moved to the burbs of New Jersey, and I continued to work in an emergency room. I volunteered in a local, it's a wonderful program called Parker Family Clinic. It's for those that do not have insurance. A lot were undocumented, and we provided care. It was all voluntary. Worked there, and were encouraged all along to continue my education, advance your education. I became a school nurse in New Jersey, kind of kicking in screaming. I didn't know I would really like it, but I knew it was one of the best choices for my family at that point. So I did go on and I got my certificate in New Jersey. It's a post-bachelor certificate in New Jersey. So I went on, and with it changed my life. It was something that I didn't expect it to be as wonderful as an experience as it is. And as everyone knows, school nursing is what you make it. And I've been very fortunate to be a school nurse. I think it's about 18 years now. And I did finish my advanced degree. I worked second jobs in urgent cares and pediatric practices. And right now, I'm currently a co-lead nurse with Kathy Grano in Middletown, New Jersey, and I am also their advanced practice nurse. So I consult with any health crisis, any health issues. I work alongside our school physician, and it's a great place to be. All along, I've always I feel like I've always been in the mix of something, and I think it's part of my nature, but I've always kept my ear to the ground and my eyes wide open for what needs to be changed, what's not working in my practice, or what's not working where I worked, and always tried to um, change the culture of it, or change how procedures are done, or get more education for our staff. So I think my positioning all the way through kind of just unfolded. It went unplanned, but I do have to say what really launched my career. I mean, and as I kind of went along, I have to say, going back, well, I had 3 children, going back from my master's and postmasters, I had people supporting me through that, and I was encouraged by Laura Janone, and I had a coworker. Her name was Esther Sipridge, and she said, "No matter what, no one will take away your education. Just keep going to school." And that encouragement all the way along really kind of led me to who I am right now, or up until I went to the Johnson and Johnson School Health Leadership Program. I think that really propelled me forward. They they really teach you how to be. I didn't have the confidence to be the public speaker or the approach the superintendent. I didn't think I had that power. They really kind of taught me how to have that power and how to be a leader in my community. And I met wonderful people like you, Robin. I can't say enough of Martha Bergren. She's been a professional mentor to me since the Johnson & Johnson program. And still, I can call her with an issue and she'll call me back in an instant. And she's always encouraging me for the next steps and what I think I need to do, not directing me, encouraging my thoughts and my leadership.
What I've noticed about you, Eileen, is that you seem to be ahead of the curve when it comes to these huge health crises. Like, what I remember most when I first met you is how involved you were with the opioid crisis. When it was still, I mean, in New Jersey, it was huge, and in your town, it was huge. And you seem to step into these healthcare crises, not only step in, but lead response. So I want to know from your experience, what drives you? How do you know what is happening next? You just seem to have this uncanny, I don't want to call it intuition, although I'm sure that's part of it, but what drives you? Who is that in you, Eileen, that you are this kind of edge runner? You just seem to know what's happening next.
Well, with the opioid crisis, I think I'm a good listener. And, when I was working in my community, it was right after it was post Sandy, and our community was impacted by Sandy quite a bit. I was working in the urgent cares, and I saw a lot of people coming in for opioids, and people were prescribing many opioids. So this was about 2010, 2011. I did not feel comfortable with prescribing that many opioids. And I heard about the overdoses, and in the community, there were several overdoses. Narcan was not being prescribed back then. There were no training programs. I was also working in a pediatric practice, and I had a family, a young mom say, "Can you write me a prescription for Narcan? Because I'm so afraid I'm going to find my 14-year-old dead, and I want to give Narcan." That was driving force. It was something like that that said, this needs to be addressed. We have 14-year-olds and parents concerned about having Narcan on hand. And I started investigating it, connected with Becky King from Delaware. And that kind of led to having Narcans in school, try to push for legislation in New Jersey to have Narcan in every school. I wrote the standing orders for our school. Our school was the first in New Jersey to have Narcan in their high schools.
At the time, you were in a preschool and an elementary school, weren't you?
Yes, I
Right.
was. But I was also working in the community. So I saw that the community was being impacted, and I knew it was just a matter of time. Our schools are part of the community. They're used all the time on the weekends and sporting events. I knew that having it available in the schools was really important and might save a life. So that kind of started that whole snowball of people saying, yes, you're right, this happened. I've had people report incidents where Narcan could actually have been used. And we kind of jumped on board with the first responder grant and training in New Jersey. So I got all our nurses to go down to Atlantic City, and there was a needle exchange program there that was training Narcan use to those that use the needle exchange program. She trained our nurses in Narcan, so that was the first time we would train. And I also have to say, like, these projects were the result of having the support of my administration, because that, taking this on and having someone listen to you and having the support of your administration just makes a difference, because I've spoken to many nurses that administrators wouldn't support Narcan in schools, or wouldn't support trainings for nurses and vaping and different didn't see the value of nursing, really didn't see the value of school nursing. But I am very fortunate. I've had the same superintendent. I think he supported us going to the J&J program. That was 2013. He's been there. His name is Dr. George. It's okay if I say his name.
Yeah.
Right. And his assistant superintendent, Mary Ellen Walker, both of them have been open to different ideas. She understood the value of having Narcan. I had the conversation with her first, the value of having Narcan in the schools, because she was a teacher before she was a superintendent, and she knew of a student that just passed from an overdose. So she knew it was impacting our community as well. So she agreed. She said, try to find the training. I did that. She supported having all the nurses go to Atlantic City, different shifts, high school nurses. Then we had the middle school nurses trained. So, it's kind of unplanned. It's just, to me, I feel like I've always kept my ear to the ground, eyes wide open. I didn't ignore the signs when things were happening in the community. And just like this COVID situation, I knew it was happening. We've been in touch with the Nurses International. We know what's been going on in Europe. We knew it was coming. I had many students traveling in February from Europe. Middletown is within an hour commute to Manhattan. My husband travels there every day. So we have a lot of commuters from Manhattan, which was experiencing a lot of COVID outbreaks. But when I started working with my health department, which I do quite often, to report what we're seeing, who we're tracking in the schools, a student that just came back from Italy, a sibling might have been symptomatic. So we start tracking those things in the school and sharing that information with our health officer. I saw that he started getting positive COVID testing in, and he started this communicable disease investigation, which now it's the buzzword is contact tracing.
Right.
So I volunteered. He was training staff that have no medical knowledge, and he was trying to do the best he can to do the contact training. And honestly, he trains someone, and they are still doing them. Staff that, like the animal control officers or personnel that really don't have the medical background that nurses have. So I asked him if he would allow me to help him out a little bit, and he said he had to check at the county level and whatnot.
Can I just stop for 1 second? Was this before school was called that we were doing distance learning, or was this after?
It was before with me.
Before,
I
okay.
volunteered to help him out at the beginning of March. So I started doing that. He did like a one-on-one training with me. And it was good because I also knew what was happening in the community by doing the contact investigations and how it was impacting our school. I had a direct line of communication to the health office when there was a question with a staff member or a possible contact within the school. So I had that relationship already before the schools even closed. So I helped him out for a week or so, and I said, you know, I have 18 nurses. I don't know if they would all be on board with doing contact investigation, but he was getting 40 a day. To do 40 cases a day with, you know, 5 people or less. Um, you know, I said, I do have these nurses that are probably will be willing to help out. He said, okay, let me clear it at the county level, see if I could do that. Um, as I was doing the contact investigations, though, I realized it really aligns with our school nurse practice. Like it's surveillance. It's when I'm doing the contact investigation, I'm also teaching and educating them about who should quarantine, who should isolate, how to disinfect their bathrooms. Can they truly be isolated in a small household where they're sharing a bathroom? How long those that are quarantined have to stay quarantined after a person comes out of isolation. I give them my number. They're isolated. I make sure they have food. They have food in the house. Do they have enough supplies? We don't want them leaving the house. And I think I shared with Robin, once my nurses started doing it, it really became more case management because we found out a family had a 7-month-old and both parents were positive, and we were able to reach out to our contacts and get baby formula delivered to the house. Really trying to contain the virus at the household level, within household members, preventing them from getting infected. And I really felt like we could really make an impact as school nurses. So I brought it to our school nurses. I brought it to our superintendent first because, you know, most of the calls would be done during the day. And they were very supportive.
Your nurses were home getting paid doing this virtual school nursing. Okay, so you brought it to your superintendent.
Once we went on to virtual learning, the positive cases kept
coming
in, higher numbers. The testing expanded, so we were seeing more positives. So I brought it to my superintendent, and they were willing to allow the nurses to do this collaborative project with the health department. And I developed a training, and we put the training, we trained the nurses, and I expected, it's more work. So I expected a handful of nurses to join me in this project. But every single one of them have embraced it, and every single one of them, you know, I say they are my rock stars, my successes, and for them to follow me into this project without even questioning it and coming back to me and saying how they feel as though they're really making the impact with this COVID virus right now. You know, if we can contain it in our community, we can hopefully keep people out of the hospital. So, you know, we really feel like this is important work and it aligns with school nurse practice. So I've been trying to push it out there in New Jersey that we need to get this organized and get the training out, because they're calling for us at a state level. They're asking us to register, which we all have and we all want to help, but there's just so much going on at the state level. I don't think it's trickled down to the local level. So I'm asking nurses to reach out locally, take the training that I'm doing, reach out locally and make those partnerships and try to bring it from the grassroots up to the state.
So speaking of grassroots beyond, I want to talk about the school nurse chat that kind of amplified the work that you're doing. So, you know, we hold these periodic school nurse Twitter chats, and we call them school nurse chat. They've been getting more and more popular, and nurses are joining all over the country. And I want you to talk about the last school nurse chat, and because the power of social media cannot be underestimated in your story, in this story, if you want to share a little bit about what happened during the chat and after.
Sure. So during the chat, we were on there, and what we're doing with the contact investigation or the communicable disease investigations, I really feel passionate about it being the first step for us to consider with reentry. We need to know what's going on in our community before we re-enter into school. So I've been telling through my trainings, I've been saying we really need to think about reentry. We need to be involved in the surveillance of our community right now and manage what we have right now. But this is the first step because when we reenter, whenever that is, we need to have a plan, but we also need to know what the guidelines are. We're going to have kids that are going to be quarantined for 14 days. How are we going to know those kids are being told to quarantine? And they might be returning to school as opposed to staying home in quarantine. There's so much unknown. So in the school nurse chat, I have started working with Mary Ellen Engel, Kathy Grano, and Anna Toupé. We kind of brainstorm, and it's a wonderful, innovative way of coming up with plans. And we started a Google Doc, and just, you know, as concerns developed with re-entry, we put them down on this Google Doc. If we find any guidelines, we put that in the Google Doc. What the recommendations are. I've been sharing what the Department of Health is recommending as far as isolating and self-quarantining. I shared my flow sheet and guidelines, and they're using that. They have not been able to make that connection with their health department, but they're calling all students that are sick or reporting their families are sick, and they're doing the education that's provided.
To another school.
And Anna Toupé is in New Brunswick, North Brunswick.
Yeah.
So even though they haven't made that connection, they are getting that information out to their community, and they're watch guarding their community, which is wonderful. So anyway, we've been working on this, and with School Nurse Chat, one of the questions were, do you have a reentry plan? And I wrote, well, we have been brainstorming and having meetings about reentry, and I've asked to be on, you know, before that door closed on the 13th and we went into virtual learning, I said, school nurses need to be a part of the reentry plan and be on the committee. And they told me that they absolutely would include us in the reentry plan. So I had written that school nurses need to ask to be part of this plan now. Even though it might be September, it's a lot to organize and a lot to consider. So stepping up and asking to be a part of the plan is really necessary. And I think I put that in the tweet. So with that tweet, Lori Combe had said, can I come to one of your meetings? Or I'd love to see what you have, or something to that effect.
So tell us who Lori is.
Lori is the president of the National Association of School Nurses. So with one of our—
How do you know her?
She actually, both of us are alumni from the Johnson & Johnson School Health Leadership Program from 2013. The team from New York loved the team from Texas. We had a great time together the week we were there. And we have stayed connected through the last 7 years on issues that are affecting, especially there's been a lot of hurricanes and natural disasters and how it's impacting school nursing in Texas. Same in New Jersey. We've always shared our information. She would ask about, you know, how we're handling certain legislation in New Jersey versus Texas. So we were always comparing notes. And we had planned a Zoom meeting, and she attended our meeting.
Nice.
It was last week. We shared all our documents and our discussions, and she asked if she shared with me that she's working on guidelines with the CDC for reentry, and that they are going to share our notes with the planning. Yeah, so and that did come out of School Nurse Chat. It definitely came out of School Nurse Chat, those connections. And you know what, it's so important. I am not a big social media person. I read my social media. I get a lot of information from my social media. I don't post a lot, but I do make those connections and have those connections and reach out to people, push important information out to people too through social media. And it is so important. And especially now, to have the president of the National Association of School Nurses easily drop into a video chat.
It's true. It's fantastic.
You know, it is pretty fantastic.
So, I mean, this is such a positive story for school nurses, you know, locally, nationally, and also, I mean, you know, you talk talk about prevention. I mean, the things that your district is doing, that your school nurses are doing, you're changing hopefully the trajectory of this virus in your community. And I know there are school nurses across the country that are also doing
They are.
this contact tracing, and this is so, you know, we need to blast this all over the place, the things that school nurses are doing across the country, so that people really understand the full scope of our practice, right?
Yes, and I'll give you an example. When I do an investigation, when I speak to the person that's positive, they're usually isolated, and like they have a history of depression, anxiety, um, and they'll share with me that they're really having a difficult time with the isolation, and that their mental health is an issue. They're worried about their meds, so many things. And it's an opportunity to refer them for a resource. I've given out the Mental Health Association's hotline number for New Jersey, which is available 8 a.m. to 8 p.m., where they can talk to someone. They don't want to burden their families. Their families are terrorized and about this virus, worried they're going to be in the hospital. So they really hold a lot in, and they really need to come out, if it's just via phone call or virtual health visit, mental health visit. So these are the things that we're making the connections, and it really is nursing. We've also I have a young girl, I think I told you yesterday, her mom's very sick. She's by herself in the household, and she's a young girl, and I check in with her every couple of days to see how her mom's doing. Is her mom going into the hospital? Is she becoming symptomatic? We've got food delivered. We're very fortunate in Middletown. There's a lot of resources. We have Middletown Helps Its Own, and I got a box of food delivered to the house, including cleaning products. I told her how to disinfect the bathroom, how she should be isolating. We got them some homemade fabric masks so her mom can use that when she's in the common areas. So those are the things that are going to stop this virus. If we're just letting people isolate in their house and they're passing it among themselves and then feel they're asymptomatic and going back out to the community, we're not really impacting the virus. We really need to keep them home. We need to keep them as healthy as they can mentally. So it's difficult I'm finding it difficult. I'm sure everyone else says.
It's cumulative,
It is.
the more the time kind of piles on. And these touch points, we can't physically touch people at this moment, but in our role, but we can certainly emotionally touch them, spiritually touch them. I mean, just having a face-to-face through a video conference, I mean, it feels good. There's a connection, and that's really, I feel like one of the biggest, mistakes that was made through this entire process is not using the term physical distance and using social distance. I think people really had a misunderstanding of what that meant, and we need to be physically distanced, but we need to be socially connected.
Absolutely.
I wish that they switch that. I mean, words mean everything. I have a question for you, though. You are giving so much. You are such an inspirational leader. What do you do to ensure your own growth and development for you?
For me, professionally or personally?
Both.
Well, I have to say, professionally, I belong to all my associations. I'm active at the state. I take on things that I have to learn. I feel like I am that lifelong learner, and I'll take on something such as legislation. Robin and I are co-chairs. So I took that on
My God.
knowing nothing, had to go back to school. What's the video?
Schoolhouse Rock.
How a law becomes a bill. Like basically knowing nothing and learning as I go. And I really feel like that is how my life is. I figure it out as I go. I'm thrown into chaos. I think that's my ER mentality. Throw me into chaos. I'll triage it out. I'll figure it out. I'll get the important information that I need to know, and I'll learn it. I will become, proficient in this. I'll make myself the expert. It might take me a while.
You make yourself the expert, and you're a credible voice, and you're a calming presence.
Yeah.
You really are. I have so much respect for you. I want to know where you get your most creative ideas. They fascinate me, the things that you have come up with, Eileen.
Well, sometimes it needs to be reeled in a little bit, as you know, Robin. But I don't know. I feel it's wonderful when I am with a think tank of people that think similar to me, similar like you, Mary Ellen Ingle, those that lack any negativity, that that won't squash any ideas, you know, just free thinking and making suggestions, taking my thoughts and building on it. Like that is inspiring to me. And I think that's really where most of my creativity, I've always been creative. You're creative as well. I have a creative nature. But as far as professionally, you know, sometimes it gets me in trouble. It's not always successful.
I like when we get in trouble, Eileen.
I can say I got in a little bit of trouble when I said we need to speak at the Senate committee hearing. So, you know,
It's okay.
I did speak,
Speaking
but
truth to power is what
I did
changes
speak,
will change the world.
but not everybody agrees with your opinions and voice, and it's hard to take that sometimes. So, you know, it's a learning process, and it hasn't changed my mind. I would still, you know, continue with my professional opinion, and it is a professional based opinion. So,
Yeah, it's steeped in evidence and fact and
evidence
science.
based.
That's who
Yes,
you are.
yes.
So let's go back to, because I want people to really understand what you've done in creating this training, how they can access it, what this means. I know that there may be different rules for different states, but tell us a little bit more about the training. We're going to make it hopefully part of this offering that people can listen to. And what are the next steps around it?
So right now, I have presented it to my county and the state executive boards. It's on our website. It's a video that I created for my school nurses specifically, and it defines what quarantine is, what isolation is. It's following the Department of Health guidelines for contact investigations and recommendations. And I created a flow chart with links that bring them to the Department of Health. So it shows the evidence-based recommendations with the flow sheet, the flow chart. So I brought that forward from just my school nurses to the county, and I'm asking a lot of nurses to take this training and reach out locally to their health officer, see if they can help them out, develop those partnerships. I think that's really important because we're going to need them when we re-enter. We're going to need the health officers to help us re-enter to the schools. So instead of waiting for an assignment from the Department of Health, we're going from making the connections at the local level with a with an education of what a contact investigation entails. So that's what my video is about. I am going to try to create one. It's true. This is definitely geared for New Jersey, and New Jersey follows the CDC recommendations. So it's similar to it. It aligns quarantine, isolation, everything is the same as the CDC recommendations. But doing contact investigations vary from state to state to state. Some need a certification, some others it's done by nurses, so it really varies. So you would have to check your state recommendations or requirement as far as who does the
For
contact.
general knowledge, this is a wonderful, kind of um, encapsulation of everything that school nurses need to know if they're interested in doing contact tracing, regardless of where they live.
And I have to say, even if they're not doing contact tracing, I've had parents call and say, I just got a test result, my husband's positive, my son's not feeling well, and nobody's called from the health department yet. So right away, and if we could get the message out, if you suspect it and you get a test, that person must isolate. So the sick isolate, they need to isolate from everyone else. And that can happen within the household. So isolate everyone else quarantined. So getting that word out there, and if a nurse gets a phone call from a parent, having that information and what is going to be recommended is, really important to get that started. It might be delayed because the health department might be overburdened right now with cases. So it might take a week for them to, hopefully not, a week for them to reach out to that person, or they have the wrong phone number or the wrong address. So there's a lot of variables. So if you're making that contact with a parent and they're experiencing someone with COVID in their household, like having that information, getting it to them right away, connecting them with their resources. Say that's it, no one's leaving the house. Do you have food in? Maybe we can get, because a lot of them are seniors. Can we get Meals on Wheels in there for you? Let me contact social services and get Meals on Wheels in there for you. Do you have enough medication in? Can we call the pharmacy and get your medication delivered? Like there's so many variables that people will go out into the community, and that's not what we want. We want to keep them in. So even if the health officers are not open to you doing contact investigation, the education and prevention is really important that school nurses have right now.
Well, I can't tell you how much I appreciate you making it open access, Eileen.
Yeah, no, I think it's great.
The more that watch it, and you are also available. I don't want to throw you out into the world, but you're available to answer questions and possibly do presentations around this. Okay, I want to get the health commissioner, Judy Persicoli's attention with this because she is a nurse, and I think you would be a great partner on the state level. You're already working on the national level, so let's see how far we can get this, Eileen.
It would be wonderful. I've been tweeting her, but she's a very busy woman and she's doing a phenomenal job in New Jersey. I'm very proud that she's leading us. I am so proud that she's
so much respect, and for the governor too. I'm great respect for him. So my last two questions before we wrap up. I can't believe how fast this time has gone. I just wonder if you can give some advice about, I know it's hard to pick one key skill, but if there is one key skill that school nurses need in today's environment, thinking about going back to school, doing the work that we're doing virtually, what do you think that one key skill is that you would recommend just in this moment? It could change moment to moment, but just right now.
I really think that they have to be visible out on social media. I think it's really important to make those connections now, even going through nursing school, get out there and make those connections, because follow the CDC, get your updates every day, know what guidelines are being changed and what best practices are, what webinars are being offered. Just get on Twitter, I get on Instagram, and I think that's the cutting edge need for nurse leaders right now. I mean, of course, we have to follow evidence-based practice and, honor our nurse practice acts and whatnot, but getting out there, making the connections, knowing what other countries are experiencing, how they handle different things. I mean, it's just super important right now, especially right now as this unfolds.
So my final question for you, Eileen, is I would love you to share one favorite quote that inspires you.
I think I shared this with you, but if you were in my physical health office, I work in a high school, and as the kids enter, I have a piece of wood carved right above the entrance, and it says, be the change you want to see. And that's Gandhi's quote. And I really feel there's so many great kids in high school, and they really look at that and understand that. I hope it inspires them. It has inspired me. And I guess that really has what's driven me all along. When I see something unjust, I just feel like I need to change it. It needs to be changed. So.
And you do that. You are that. You are 100% that. Well, thank you so much. I am so honored, thrilled. I am inspired by this conversation, and thank you for being my very first guest, Eileen.
Thank you, Robin. I have to thank you.
Be safe, be well.
Yes, and stay healthy, everybody.
Yeah, thank you for everything.
Okay, bye-bye.
Wait, stay there. Oh.
I can't hear you now.